South Africa has officially entered a third wave of COVID-19 infections after it reported 9,149 new cases on Thursday. The country's National Institute for Communicable Diseases, or the NICD, says the increase in cases has brought the national 7-day moving average incidence from 5,959 cases, which exceeds the new wave threshold as defined by the government's Ministerial Advisory Committee. The MAC, or Ministerial Advisory Committee, defines the new wave 7-day moving average threshold as 30% of the peak incidence of the previous wave. Professor Bruce Mellado is a Wits professor and senior scientist at iThemba Labs and member of the Gauteng Premier COVID-19 Advisory Committee. Thank you so much for joining us, Prof. So the majority of the new cases are from the Gauteng province. I think that's 61%. Let's start with that. You sit on that committee, the provincial committee. How concerned should we be as Gauteng as a province first?
Thanks for having me. So indeed, as you correctly point out, a lot of the cases nationwide come from the Gauteng province. We have 2 and possibly and most likely 3 days in a row, about 5,000 cases in Gauteng alone, and that's a very big increase. What worries us the most is not just the absolute number, but the fact that we are experiencing a spike, meaning that the growth of the week so far with respect to the previous one has shot up to 70% from 37%. So that's a very big acceleration in the number of cases.
And I also want to understand this within the context of the test positivity rate. I think it's almost at 16% now. To the layman, what should we understand this to mean?
Well, the positivity rate is a measure of community transmission, meaning if it is above a certain threshold, and for this country set at 10%, that means there's a lot of transmission of the virus from one person to the other, and that's a sign of a wave. So that's one of the indexes that we look at to determine where we are in the pandemic. Unfortunately, that number is significantly higher than 10%, as you correctly indicate.
So the provinces that are continuing their peak in numbers, we spoke about Gauteng, there's Western Cape, and both the Free State and the Northwest provinces also accounted for a 6%. You talk about the community transitions, or rather community cases, infections. Just talk to us about the differences in the districts and the regions. Does that have to do with how the province itself responds to the spread of the infections, or what is creating this major difference?
That's a very good question. Well, right now we don't have a major difference compared to the second wave, and I'm talking about Gauteng at the moment. If you look carefully at the geospatial picture, how the cases are distributed, you now unfortunately see a picture whereby the cases are spreading throughout the entire province of Gauteng. We've had very active districts such as Sedibemba. Right now, we have the sub-districts of Tshwane and Johannesburg and others being extremely active. So we can see now that community transmission has spread throughout the province. Now, what is different in this wave compared to the second is the fact that mobility is extremely high. If you look at the latest mobility reports, and we're very eager to see what happens this Sunday when we get the new ones, you see that the mobility is the highest in Gauteng since the application of the hard lockdown earlier in 2020 and close to the pre-COVID-19 numbers. So this basically means that we're moving a lot. And as a result of that, we are seeing, and this is our interpretation as a committee, this spike that we are experiencing right now is due to the fact that we are moving at the same time of not really adhering as we used to social distancing measures, which is one of the key causes of this spike that we are experiencing.
Okay. So in relation to how severe the third wave is or not going to be, how dependent is this on the cluster infections?
Sorry. Okay. So right now, it's when you look at the numbers very careful, and we do a very careful examination of the numbers. The first 5 weeks of this wave have been relatively slower compared to the second wave, but we are seeing this sharp spike this week, where we see an increase of 70%. So that's a very big source of concern. So right now, as advisors to the Office of the Premier, what we are considering is the worst case scenario, where according to our calculations, we should expect the worst case scenario of about 65 to 70,000 active cases at any given time. And that is compared to what we have right now, which is about 30,000. So we still have some way to go.
All right. Thank you so much, Professor Bruce Mellado. He is Wits Professor and Senior Scientist at iThemba Labs and a member of the Gauteng Premier COVID-19 Advisory Committee.